It's live, right? Very good evening to all eminent doctors. Thank you so much for joining us for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriate vaccinated. This is an initiative from Cadila Pharmaceuticals through its innovation to serve the society and humankind. The topic of webinar is novel 3-dose G protein vaccine, ultimate key for compliance. Dear Dr. Travis is the world first novel 3-dose anti-rabies vaccine, and with great pride, we'd like to inform you that Travis has successfully completed 1 year of launch with more than 40,000 ml bite victim being vaccinated, and 100% compliance was recorded, and no case of adverse was registered. With this, it is my honor to introduce you to the speaker of today's webinar, Dr. Saurabh De. He will mention some points related to Dr. Now I would like to request Dr. Saurabh De to initiate the talk, and later on we will have a question session, as the participant can drop the question in the drop box and we'll read it out, and after presentation we'll clear the answer. Thank you, sir. Please start.
Thank you for giving me the opportunity to talk about rabies. Meanwhile, where I'm working in a rural hospital long ago, I seems to be the nodal officer of the rabies, and there I learned a lot and how fatal this disease is. And most important thing, when starting with the slide, that globally around 59,000 human deaths are highest in India. Somehow this reporting data will mesmerize you with the fact that 20,000 human deaths a year from the rabies, accounting around 60% of the rabies death in Asia and 35% globally. 91% deaths in India occurred in rural areas. But one thing which is not being written here, one thing which we feel every day, one thing we have been witnessed and experienced for the last 10 years, but particularly while I'm working in the rural hospital, I'm not now, but what I've seen at that point of time, that the number is quite large at around 5 times, because most of the cases are not been reported to the hospitals. They are not been totally been they are itself been submerged under the burdens, and they are not been taken to the hospital itself for the treatment. Rather, they are been treated for other neurological disease where they belong to the rabies. One of such that patient came to me long back, around 5 to 6 years back, presented with a quadriplegia, which I have diagnosed in my clinic. That patient seems to be a case of a rabies. We have been taken to the hospital and further treatment have been given, but unfortunately, rabies seems to be a disease where the chance of survivability is very less. So he also died. But the issue is that the issue about the under-reporting of the events or the cases of the death is there. Even after that, there is a huge chunk of around 20,000 human deaths occur on rabies a year from the rabies. This is an alarming aspect, and this also throws light at what which actually should be done for the treatment of rabies, or rather post-prophylaxis treatment. Now, just wait for a while. Previous slide, I want to go. Just wait for a while. Okay. Every 9 minutes, a person dies of rabies. It's very true. Now, what does actually we mean to know about the treatment of the rabies? Now, first and foremost, the local wound treatment is very, very important. Completely cleaning the wounds for 15 minutes with the soap water is very, very important in each of the nature of the wounds, from the category 1 to category 3 bites. Now, active immunization is an important area. Another, the passive immunization, that is the we're talking about, that is a rabies immunoglobulin also, which has been another important aspect, which seems to be very important, but it's often not available in every part. So there is the part of the government also to make it available to the every corner of our country, so that to minimize the death of very bad category 2 or category 3 bites, where we readily needs this immunoglobulins. Now, 5 doses of intramuscular vaccines are there available in the market nowadays, of which 0, 3, 7, 14, and 28 are the anti-rabies vaccine. At the very first day, we have to give a rabies immunoglobulin in a category 3 exposure. Our own toileting is mandatory in most of the cases. This is overall the treatment of rabies being known to everybody. Now, non-compliance is an issue. Why there's a non-compliance? The current rabies vaccines are cell culture vaccine. Inactivated vaccines are greater than 50 years of old technology. The issue is that with inconsistency in potency, stability, availability, and short supply and adverse events. Today morning, I can share the picture of one of my WhatsApp messages that today morning that one of my patients have been the scratch from rather a category 1 bite, a category 2 bite from for a dog having buy 2 doses of a particular brand anti-rabies vaccine, and now giving me a call and on WhatsApp that the other 3 doses are not been available. So there comes a scarcity of availability of vaccine in all over India. It is a true fact. We have to accept it, and so we have to come out with a solution, because there is no cure for the rabies. The only cure is to take the vaccine, the post-prophylaxis at the right time to prevent the zoonotic disease. The availability, short supply, and adverse events are the important areas of where we are been shifting our movement from this non-compliance and from the non-compliance, while we are using this new modalities of the treatment, that is G protein coupled vaccines. Now, the compliant are those who receive the full course of ARV, and this is the scheduled dose of ARV on the recommended dates. Delayed compliant means who completed the schedule of the dose within a period of 60 days, but deviated from the schedule regime. That means we have taken the first dose of the vaccine on the very right day. He have mixed the third dose, but get notified again given the third and fourth dose, and even the total dose have been completed by the period of around 60 days. That's very important for the seroconversion. Who are dropout and non-compliant, who had at least taken 1 dose of ARV after the animal but do not complete the all scheduled dose within a period of around 60 days are basically the patients who are dropout and non-compliant. Why we're talking about them? Because the number of the dropouts and non-compliant are quite high due to several reasons, as we have already been discussed and further been discussing. Now, rabbit post-exposure prophylaxis practice in the view of the new Centers of Disease Control Prevention have shown few of the important aspects. What are those? A retrospective analysis of the travel clinic shows that a total of 110 patients who received rabies 4-dose PEP. Shortcomings in the management of these patients were late initiation of rabies PEP in travelers. That's very important. Administration of human rabies immunoglobulin is another one of the largest shortcomings in our country, and antibody levels less than 0.5 in 6 of us out of 90 patients after the 4th dose of vaccine. That's another very important area, which has totally been obscured after this trial. That's even after the 4th dose of vaccination, the antibody less than 0.5 been seen even around 6 out of 90 patients. Is a very, very alarming issue, which should be been addressed by the good quality of vaccines. Now, patients do not always receive the optimal rabies PEP under the real life condition. That's very important. A significant proportion of patients did not develop adequate antibody dose even after the 4th dose of vaccination. So the 5th dose are often being there, need to be there. This is an eye opener. This is an eye opener because we know the long back, around 4 to 4 years back, there have been several guidelines have clearly revealed the fact in most of the category 2 bites we can manage it by only 4 doses of 0, 3, 7, and 14. But it has been also been observed that around 6 out of 90 patients have not been controlled of this of the 4th dose of the vaccines. So something to be done to make the compliance and the safety and efficacy to be bridge this gap. So what is that? We will be discussing in a minute. Now, reason for the death may be due to the lack of administration of rabies immunoglobulin or the poor compliance to the vaccinations. Now, this may be a very important fact. That is, a 58 years female has split drug killed soon, having a 3-dose of purified chick embryo cell vaccine have been given. Chronology of the events have been seen that even after having a vaccination 3037 dose, it has been diagnosed with rabies encephalitis, and hospital in this survived for around 16 days, but died after 1 day after their discharge against bites. The same thing been happening on other instances also. In all of the cases, it's been found that non-compliance is the major issue, where they have not been receiving the dose to the full amount, and only they are receiving 3 doses. It also happened in our community, quite common. Now, let us talk about the compliance. The compliance to post-exposure prophylaxis has been taken care of by, been studied by Richa Kapoor and Manasi Panda. They have been found in Safdarjung Hospital on 360 animal bites, and on 53% were non-compliant to the full course of ARV. It's very, very alarming. Even after that kind of a data that where only 3 doses of the vaccine does not provide, or rather 4 doses of the vaccine does not provide a full course of the antibody level. Here we are still being non-compliant. we are inviting the death from alarming deaths, because we know very well there is no cure to the rabies apart from the post-exposure prophylaxis. Now, compliance to the anti-rabies vaccination in post-exposure prophylaxis gradually being decreases as the day progresses. It is quite common. It's quite common with any of the vaccines or any of the medications. It is a normal human psychology. Compliance to anti-rabies vaccination from day 0 to day 3, day 7, day 40, and day 28 have been reduced to around 60% only. The compliance rate for intramuscular rabies vaccination was around 60%. Yes, in Municipal Corporation Hospital, it has been studied and it has been proved that its compliance is only 60%. Now, interference with the school timing. Yes, another important issue. We often know that normally the hospital give a vaccination between a period of around the morning to evening 5 o'clock, which is basically classes with the school time. Distance from the hospital is another important aspect in the rural part. Cost incurred is a very important issue, and forgotten deaths are there very much, because there is no such body, no such organization, where no such group, the rabies alarming group, that can allow the patients who can take care of the anxiety, who can take care of the proper understanding of the proper knowledge important to the patients who are receiving the vaccination, that will that will make them compliant for these deadly diseases. The major constraint from the compliance to the complete area was loss of wages. That's very important. Yes, we have also seen in the rural areas the patient gone for a farmer going to the field after taking a single vaccine. They're only concerned about the tetanus toxoid. Once they have the tetanus toxoid on a vaccine for the first day, they believe that they have been protected. But the issue is that there should be companies impressing upon the fact that protection can only be achieved by the full seroconversion by giving a post-exposure prophylaxis. The minimum, as much minimum has been done with the newer onset of the G protein vaccines, that will take care of these compliance issues. Now, let's take care of what are the evolution of the rabies part. The live attenuated virus of the that is obtained from the spinal cord in 1985 showed 31 injections. We haven't heard about that. Then comes the issues of inactivated vaccines, brain up to 10, which are also around 14 injections are there. In our early childhood, we have used to hear about that is 14 injection of rabies. There comes the 1976 for the cell culture vaccines for the 5 injections, the intramuscular, that is from there, 0, 3, 7, 14, and 28 doses have been administered in most of the cases. Non-compliance led to the evolution of the treatment of regimen from 31 dose to the 5 dose, and still on. And now we are coming to the regime of 3 dose of the vaccine. And now we are introducing a novel vaccine with a sample of a shorter regime, with a better protection, with a good seroconversion rate. Novel 3-dose recombinant rabies G protein vaccination. Now, the G protein seems to be the first subunit of the vaccine prepared from the VLP platform technology. First vaccine will have a 3 dose of 037, better compliance due to easy flow regime and convenience and ready to use, and no reconstitution is needed. Now, why it's so much important? There is native virus. It behaves just like a native virus, where this G protein is difficult to stabilize. G protein is isolated using a VLP technology, purified and stabilized in the by the pharmaceuticals. Virus-like particles are protein complexes exist in the nanoparticles. These VLPs are responsible for the generation of the antibody from the particular cells. VLP is similar to the native viruses. It cannot replicate but can mimic the viral antigenicity without being pathogenic. They are capable of producing the strong humoral and cellular immune responses, which has been demonstrated by antibody level after a particular point of days. Now, let us talk about the study design with a 2 doses of vaccine, and 037 3 doses of the vaccine with 10 microgram and 50 microgram have been done. The seroprotection rates have been shown. It has been observed in the 42 days. Quite good. Now, it has been compared with that of the Rabipur vaccine of the 037, 40, and 28, which seems to be at par with the present standards of the Rabipur vaccinations. Now, let us talk about a trial of safety and immunogenicity of a novel 3-dose recombinant nanoparticle rabies G protein vaccines administered as a simultaneous post-exposure immunization, randomized from a comparator control multicentric phase 3 clinical studies done by rabies HS, Akash Korvandre, Durga Satpathy, and others. Now, what they actually find? They actually find to evaluate the immunogenicity and the efficacy of the G protein virus, G protein vaccines. Total 800 patients have been taken, randomized into 2:1, where they have been 533 subjects have been put into the regime of 037 regimen, whereas 267 subjects are put onto the 037 and 28 regime of Rabipur. Now, what are the efficacy? If we talk about the seroprotection and the efficacy, the results were consistent across the different groups, observing the difference of 1.52 with the pre-specified margin of less than 4%. Now, non-inferiority for the seroprotection, primary endpoint of day 14 and day 42 were comparatively met. Test and comparator are identical in seroprotection rate, both on day 14 and day 42. That's very important because we are comparing this rabies against the already established molecule of Rabipur. Now let's talk about the rabies and Rabipur. The adverse events are comparatively less with the rabies. Local adverse events are comparatively same. Redness, swelling are comparatively less. Systemic adverse events such as fever, ear pain, headache, urticaria, joint pain, and nausea seems to be all better. Apart from the urticaria, seems to be a little more with the rabies, only 0.19%, and which have been taken care of rationally. Now let's talk about the other important aspects. What is that the novel 3-dose was non-inferior to the reference vaccine, less adverse effects compared to the reference vaccines, and novel 3-dose was found to be safe, immunogenic, and was comparable to 5 doses of WHO pre-qualified vaccines.
এখান থেকে স্ক্রিনটা চেঞ্জ হচ্ছে বাট এখান থেকে হচ্ছে না মানে ফুল স্ক্রিন করলে মনে হয়
ফুল স্ক্রিন দেয় এবার দেখো
চেঞ্জ হচ্ছে এবার হচ্ছে
ফুল স্ক্রিনটা গন্ডগোল করেছো। Now what actually what has been discussing about the fact that this Travis a molecule which can clearly been seen to be efficacious and safety in all terms. The seroprotection seems to be quite evident in both in 14 to 42 days, and the test and comparator are identical in seroprotection rate both on days 14 as well as on day 42. Novel 3-dose have been better safety profile and significantly less adverse compared to the reference vaccine that is the Rabipur. But and one thing I should say and admit the fact that rabbits, there is a little incidence in the urticaria level, which has not been so much of alarming and been managed by medications itself. Now, the study conclusion when you're talking about that is the novel 3-dose was seems to be non-inferior to the reference vaccine, less adverse events compared to that of the reference vaccine, and novel 3-dose were found to be safe and immunogenic and was comparable to the first dose, 5th dose of WHO pre-qualified vaccine. Yes, the compliance is truly seems to be an alarming issue in the management of rabies. So any drug which is good compliant and have a good seroprotection and seroconversion will always be welcome in the management of a dreadful disease like rabies. Now, it has been given award of Pharma Innovation Year Award with Economic Times and Golden Globe Tiger Award in Malaysia for Innovative Product of the Year. This should be awarded because of the fact anything that help us in maintaining the compliance of so difficult a disease should always be seems to be awarded, and that comes glory in the pathway of management of rabies by this innovator molecule of the chip protein vaccine, where we use this native virus element PLP for the management, the treatment of management of for the prophylaxis for the prevention of the dreadful disease like rabies, only by using the 3-dose, which seems to be quite compliant for most of our patients. With this, I conclude the session. Thanks for your patient hearing. If we have questions, I will be happy to answer.
Yeah, thank you, doctor. Sir, some of questions are here coming, sir. What are the signs and symptoms of rabies in humans, and what are the advantages of 3-dose anti-rabies vaccine?
The issue is that in most of the cases when we the issue is that when you're talking about the signs and symptoms of rabies, when the signs and symptoms appears in the rabies, it's already too late. Only 1 or 2 individuals have been survived from this dreadful disease, but we have to isolate the individual so that other persons are get protected and treat them ultimately for the so that something can be done. At any point of time, the vaccination is there. Vaccination had to be taken, and the signs normally presented with recent complaints apart from that of the Often it has been textbook teaching that the complaints of aerophobia or hydrophobia, those are the features, but the most important features are the neurological symptoms. There's the symptoms of fever. First, initially there is a fever, nausea, vomiting, and thereafter, less like any other viral disease. With that, there comes the important presentation of neurological anxiety, or sometimes they presented with a quadriplegia, weakness of all four limbs, and there comes the tremulousness. And whenever they are asked to give water, they often there is an jaw movements, and often they will bulbar pulses are often been noticed, and jaw movements and jaw jocks we are often able to elicit. And these are the areas which have been quite common in diagnosis of the rabies. And those issues we have to rush the patient to the hospital for the further isolation and further care. So seldom if nothing can be done for doing, because it's already too late. Because vaccine seems to be the most important part to be taken within the period of 60 days, or as much as quickly as possible, when you're able to notify that patient can have a chance of rabies. Another important thing what you already asked regarding the 3 doses of vaccinations. Now, anything which decreases the better compliance, a better compliance, maybe a rabies, maybe an anti-diabetic drug, maybe an anti-hypertensive drug, it's always been welcome in Indian scenario, because we belong to the third world country with a bare minimum health health awareness or other educational educational access. So in that kind of a community, anything that have maintained the compliance and keep it within a period of around only three sorts of vaccines will always be welcome in all over the country, not only for the protection of the individuals, but also saving the wages of most of the patients who are the daily earners, bread earners, because it will save their time, and also they will motivate them to have the vaccine only if it's been given on only 3 days.
Thank you very much, Doctor, for your innovative talk. We truly appreciate your efforts. Last but not the least, we'd like to inform you that Travis has won 2 prestigious awards in innovation category, ET India Pharma Award and Golden Globe Tiger Award. Thank you very much, sir. Thank you.